Hello everyone, myself Dr. Sneha Bhatia, MPT Orthopedics and Sports Rehabilitation, in charge principal at lead Srimati S.G. Patel Institute of Physiotherapy. My today's lecture will be on physiotherapy management after prostatectomy. So this is the normal anatomy of the prostate. There is bladder underneath, prostate is there. Prostate is supported by the pelvic floor muscles. Posteriorly bowel is present, which is also supported by the spine, and anteriorly pubic bone and urethra is there. So after the age of 50, it is common for the prostate gland to become enlarged. 42% of the men aging 45 to 49 years and 18% of the men aging 50 to 54 years of age may experience prostate enlargement. So the main symptom is difficult micturition with frequency due to pressure on the urethra. So retention of urine may occur and it necessitates the urgent operation. So there are different types of prostatectomy. One is radical prostatectomy, second one is suprapubic approach, transurethral approach, retropubic approach and perineal approach. Incision most commonly used for prostatectomy is the midline incision. It requires partial or complete transection of the rectus abdominis muscle. So in this picture, approaches of prostatectomy are shown. In the first picture we can see retropubic approach incision, and in the second picture we can see perineal approach for prostatectomy. So preoperative physiotherapy. Preoperatively we can give leg exercises, ankle toe movements can be done in full range, and also the static contraction of the quadriceps as well as gluteal muscles can be done. Postural correction can be given. The patient should be taught to sit equally on both the buttocks. Static abdominal exercise can be done by the patient for 10 repetition with 5-second hold. Even the contraction of the thigh adductors can be done. Patient can be lying in the supine lying position and place a ball between the legs and ask the patient to press and hold it for 5 to 10 seconds. The patient can do it for 10 repetition, and patient can even do 3 sets of it. Pelvic floor exercises can be done for men also. The instructions that are supposed to be given are elevate the bladder, elevate the scrotum, stop the flow of urine and tighten the anus. These are the instructions that we can give the patient to contract their pelvic floor muscles. So flow stop, when we have to instruct the patient that when you are urinating, shut off your urine flow at the midstream. Remember this action. Then try and finish the emptying. This is a test to identify the muscles you need. So once patient identify these muscles, then we can tell them that these are the muscles of the pelvic floor. So each time they don't have to stop their urine flow at the midstream. Only for the identifying purpose we can teach the patient how to identify the pelvic floor group of muscles. So postoperative physiotherapy, immediately after the surgery, watch the blood pressure, electrolytes and fluid balance. These body functions are controlled in part by the kidneys. So most likely have a urinary catheter. Patients will be having urinary catheter in bladder for a short time during the recovery. So encourage the patients to drink plenty of water and plenty of fluid intake should be there. Strenuous activity and heavy lifting should be avoided for around 6 weeks. Breathing exercises can be done. Coughing and huffing can be taught to the patient. Airway clearance techniques can be taught to the patient post-operatively. And patient should not do any pelvic floor exercises while the catheter is in place. So please remember this point. Don't do any pelvic floor exercises while the catheter is in. So these are the pictures of pelvic floor exercises. In the first picture we can see the patient is in bridging position. Tighten the pelvic floor and abdominals and hold. Lift the bottom, lower and relax. Repeat it 10 times, and it can be done at least once in a day. Begin after the catheter is removed. In the second picture we can see patient is sitting on the chair. He is standing up and then again sitting on the chair. So engage the pelvic floor as you stand and sit throughout the day. And then once they have sat, once the activity is stopped, they can relax the muscle. Repeat when you bend over, lift, push, pull, cough, sneeze, laugh, and begin these activities after the catheter is removed. So strengthening the pelvic floor muscles before a prostatectomy was shown to significantly improve post-prostatectomy urinary continence and post-micturition dribble and erectile function. So anal stimulation also can be given. Frequency can be 35 Hz, pulse width can be 1 millisecond, rise time can be 2 seconds, and it can be given for the duration of 6 seconds. So intensity of the electrical stimulation can be modulated to promote the visible pelvic floor muscle contraction with no discomfort to the patient. Leg exercises, foot exercises, and static quadriceps and glutei are safe in upper abdominal operation, so that can be performed by the patient. In lower abdominal operation, start the exercise when the surgeon allows for the movement. Start with hip knee flexion and heel on the floor activities. Progress by lifting the heel and then straight leg raising. Early ambulation can be promoted in the patient. Prolonged sitting in the chair also should be avoided post surgery. Biofeedback equipment also can be used for the patient after prostatectomy. An anal probe is placed and inflated with 15 ml of air placed in the right lateral decubitus. Patient perform quick contraction and then sustain the contraction followed by a time for rest totaling 20 minutes. So after that, the active exercises are carried out by asking the patient to contract the anus as if trying to avoid passing gas. So biofeedback equipment also can be used for this kind of patients. So there was one study, preoperative pelvic floor exercise physiotherapy improves the continence after radical retropubic prostatectomy. So they have concluded that a physiotherapist guided pelvic floor muscle training program commenced 4 weeks preoperatively significantly reduces the duration and severity of early urinary incontinence after radical retropubic prostatectomy. So according to this article, physiotherapy exercise should be started as early as 4 weeks preoperatively. Complications. What are the complications that may arise after a patient has undergone prostatectomy? Bleeding, urinary tract infection, urinary incontinence, erectile dysfunction, injury to the rectum, which is rare but it can still happen, narrowing or stricture of the urethra or bladder neck, formation of cyst containing lymph. These are the complications. But if preoperatively physiotherapy is started, then some of the complication can be avoided. So these are the references for today's video. So according to my YouTube analytics, 63% of students who are watching this video have not subscribed to this channel. So I kindly request them to please subscribe my channel and share it with the friends. Thank you for watching this video. If you have enjoyed watching this video, then please subscribe my channel and share it with your BPT friends. Thank you.